Hello and welcome. My name is Kathy Lear. I'm the owner and director of Family Physical Therapy Services here in Bedford, New Hampshire. We've been in business since 1991, so we're in our 27th year of business, which essentially means that we've seen a lot of changes in healthcare. Some good, some not so good. The one you're here today to learn about is actually telemedicine. So what is telemedicine essentially? It's the remote or at-home treatment of a medical condition. In this case, we're going to be talking about the treatment of knee arthritis, a proven approach. And you're probably asking, well, how was it proven? An Australian study was performed in obviously Australia, and it was funded by their National Health and Medical Research Council of Australia and New Zealand, and it was actually published. And because of its publishing, it has gained some traction with regards to the results and the conclusions of the study. And one of the people that actually found it to be reputable as well as informative is Robert Smerling, who is a physician at Harvard Medical School. And he essentially said that the results suggesting that telehealth may be able to improve the well-being of people with osteoarthritis of the knee is only the latest example of what is likely to be the widespread application of this approach to care. Considering the millions of people worldwide who lack access to basic as well as specialized medical care, the potential for telehealth to bridge this gap is enormous. So he recognized that telehealth has wide applications on getting care that is otherwise inaccessible to people. So why did they choose osteoarthritis of the knees to run this study on? Essentially because it's the leading cause of knee pain worldwide, and it affects 1 out of 4 adults. It also worsens over time. So and many of you probably are aware, the two primary types of arthritis are rheumatoid arthritis and osteoarthritis. The osteoarthritis is of the joints, arthro meaning joint, osteo meaning bone, and it is due to good old-fashioned wear and tear. So because of that, it worsens over time. When it worsens, you get pain, you get deformity, you get disability. Basically, it reduces the quality of your life as time goes on. It's one of the major contributors to physical disability, as you can imagine, but also the psychological aspects of disability as well, because it affects our quality of life, because it decreases our ability to participate in activities that bring us joy. And it has no cure, which brings its own psychological issues to the forefront. So essentially, the study concluded that for persons with chronic knee pain, internet-delivered physiotherapist prescribed exercise and pain coping skills training provide clinically meaningful improvements in pain and function that are sustained for at least 6 months. Well, somebody's probably saying, what's the big deal about 6 months? If you do this program, if you comply with the exercise, with the education, with the training, and then stop, it proved to give you benefits for at least 6 months. Well, if you continue to do the program, you continue to exercise, you continue to use your pain coping skills, continue to participate in some activities that you're able to, you will sustain it much longer than 6 months. In fact, probably indefinitely. Remember, there's no cure, but we can slow down the progression, which is the most important aspect here. So what does a program consist of? There's three aspects or kinds of treatment that are delivered through the internet. Education is the first. We educate regarding your exercise and your physical activity. We educate about pain management and coping skills. We provide training with regards to how do we change our emotions from negative thinking to positive thinking. We teach you about healthy eating habits. What are the good things to eat? What are the bad things to eat? Remember that food pyramid? Well, think of it upside down now, because what we know is what we learned as kids, what I learned as kids, is completely opposite to what is now the accepted pyramid, if you will. There's also foods that contribute systemically or throughout our body when we consume them. So if we eat healthier, if we eat foods that aren't providing inflammation, if we stop eating those that are inflammatory in nature, these are all going to be beneficial for us. There's also education regarding complementary therapies, supplements, herbal remedies, essential oils, things of that nature. And of course, medications. What medications are good, what medications are bad for us as well. The second aspect of the program is an interactive and automated pain coping skill training approach. Now, originally we had hoped to be utilizing a program that has already been tested, and it was actually used in this particular study and has been used in some studies in the US as well now, called Pain Coach. Unfortunately, it is not available for use at the current time. It's still undergoing testing in the field. But there's many aspects of it that we can reproduce. It's about the daily pain coping skills, teaching people about relaxation techniques, medication, listening to music, things that help just chill you out. The activity rest cycling, what is that? That's learning moderation, essentially. What to do and what not to do, how much to do. It's like, if you're like me, when I go out in the springtime and I'm picking up the yard, doing my spring, cleanup stuff, I'm out there from the crack of dawn to, dusk, essentially. What this activity rest cycling is going to teach you is that it's okay to go out 1 or 2 hours at a time, and then you've got to rest. Let your body recover from it. Go out and do a little bit more. If you're cleaning the house, clean one room each day instead of doing the whole thing top to bottom and then paying the piper for it. You also are going to learn about scheduling those pleasant activities that bring you joy, that bring you that improved quality of living. Start doing the things with your friends and family again that you've stopped doing. It's also going to teach you about how to change your negative thoughts. There have been lots of studies done on the power of thinking, and the results are conclusive that when we think negatively, it results in negative things. When we think positively about things, it's going to result in positive things. So why not change the negative thoughts and get them out of our life? If you think you're going to fail, if you think you're going to hurt, you're going to fail and you're going to hurt. It's that simple. If you think about, yes, I can do this. Yes, I'm going to go out and I'm going to enjoy a walk with my family. I'm going to go cycling, for an hour with my grandson. Whatever it is. If you think it, it will come about. It's going to teach you about imagery and distraction techniques to bring you away from that pain cycle. It's also going to teach you problem solving. What do we mean by that? Well, if a particular way causes you pain, it's going to teach you how to problem solve to accomplish whatever it is that you're trying to do, whether it's something you need to do at home, whether it's something you need to do at work, whether it's something pleasurable that you want to do, but you can't do really easily, well, or with minimal discomfort or pain. We're going to teach you how to solve that, how to learn and how to modify activities so that you can do them with enjoyment and without lasting problems. Again, we're not going to cure it, but we certainly can teach you techniques on how to help it. The third part of the program is the actual telemedicine sessions. And this program is going to be a 12-week program. We're going to be doing 7 telemedicine sessions throughout the course of the program. Some are going to be 45-minute sessions. Some are going to be 30-minute sessions. And again, it's going to revolve around the education and the exercise and the training component, things we've already talked about. So you're probably saying, telemedicine, what is it? It allows us to connect a patient to a doctor, and it allows us to erase time and distance, which is really the miracle of telemedicine. So wherever you are, as long as there's internet connectivity, we can bring treatment to you, whether it's in your home, whether it's in your office, somewhere on vacation, visiting a family member. It doesn't matter where you are. It comes to you. And it's not just about doctors, obviously. Therapy is doing it. There's all types of medical practitioners that are using telemedicine today. So again, telemedicine, it's the use of telecommunication and information technology. It can include the internet, wireless, satellite, telephone. So emails, telephone, texting, televideo, these are all components of telemedicine. In physical therapy, it's often referred to as telemedicine, telerehabilitation, telerehab, teletherapy. Any variation of that is essentially meaning the same thing. So what's the program include specifically? Physical therapy assessment. Let me, precede this by saying this is not a substitute for hands-on care, but it is the next best thing when you don't have access to that hands-on care. So we're going to be using a lot of the same tools. Can't be hands-on, but we can learn a lot by using these tools and by performing some over-the-internet types of tests or asking particular questions. So we're going to check out what your physical capabilities are. We might ask you to bend over, we might ask you to squat, stand on one leg, turn in a circle, walk across the room, get out of a chair. Simple things that tell us so much. We're going to be using assessment tools like the numeric pain rating scale. Over here, you can see 0, you get a nice, no pain, nice smile on your face. 10 is the worst pain possible. It is, take me to the hospital. I cannot stand this anymore pain. In between is going to be what your pain is. People are saying, well, my pain is not the same as the person that's sitting next to me. You're absolutely right. But your pain is your pain. So each time that we check that, it is your apple to your apple, your orange to your orange. It is going to be specific to your own rating scale. So there's reliability, there's validity to that pain scale. There's other tests that were used in this study, and we're going to be using them as well, is the arthritis self-efficacy score, a pain catastrophizing scale, which means, those people that make the mountain out of the molehill kind of thing. Some people exaggerate pain. That's not to say the pain's not there. This is going to give us a more qualified measure of how reliable the information is and bring it down to some real numbers for us so we can actually identify the most important aspects that we need to treat compared to the least important. And another study called the Western Ontario and McMaster University Osteoarthritis Index. These are all qualifying types of measurements. It also includes strengthening and exercise activities. Specifically, the strengthening is going to be targeted at the lower body, the legs, the hips, the knees, the feet, the ankles, those types of things. We're going to have you do the exercises and activities 3 times a week. You're going to progress according to what your capabilities are. We might increase the repetitions or the resistance or the level of difficulty of what you're doing. We're going to encourage you to get into more physical activities like walking. Might be swimming in the pool. One of the best activities for arthritis is working in the pool because it provides buoyancy. So it decreases the weight bearing and the compressive forces at the joints. We're going to send you reminders to complete those pain coping skill training types of things on a regular and consistent basis so they become part of your everyday existence. We're going to give you monthly emails towards the end of the program that are going to remind you to continue. As long as there's hair to comb and teeth to brush, we want you to continue with the program so that there's more lasting benefits. Some of the key considerations to this program is that it's not about one aspect of the program. It's not just about the exercise. It's not just about the pain coping skills. It's a combination of the two. It's a combination of the way we think and the way we move. Without this combination, you're not going to get the same level of benefits. So it's important to practice both. It's important to do both. It's important to incorporate these into your daily routine. The exercises specifically are going to be a combination of both weight bearing and non-weight bearing. So what that means is weight bearing is when you're standing, when you're bearing weight through your feet and your limbs. Non-weight bearing is when you're sitting down or lying down, when you're not standing or bearing weight. We're going to target, as I mentioned, the legs, the lower body, the hips, the knees, the ankles, the feet. We're going to include the movements away from the body and movements towards the body. We're going to include working the buttock, which are the glutes. We're going to include working the quads, which are the muscles in the front part of your legs. The hamstrings, which are the muscles on the back part of your upper legs. The calf muscles and those muscles that control the feet and ankle. The picture on the left is a picture of a non-weight bearing exercise. As you can see, the person is sitting. Long arc quads, short arc quads, straight leg raises if you're lying down in bed. Middle picture is what I affectionately call a sit squat. People say, well, aren't squats bad for your knees? When performed incorrectly, they are bad. They create a shearing of force. Even the word shearing sounds awful. But when done properly, they're one of the best exercises that you can do. Over to the right, you got heel raises and toe raises, which strengthen the muscles of the lower leg. Other treatment besides the exercise includes review and use of normal medications like the non-steroidal anti-inflammatory drugs or NSAIDs. Two of the most common are ibuprofen and Aleve. We also utilize analgesics like aspirin or acetaminophen. Topical anti-inflammatory products like BioFreeze or the Asper cream, their lidocaine patches, things of that nature. And also there's more use of the essential oils. And essential oils are utilized for a lot of health and wellness issues across the spectrum. In this case, there's a picture here of Panaway, which is manufactured by Young Living, which is one of the most reputable essential oil companies out there. If you think of the word pan away, it's kind of like a play on words about pain away. Um, Also, corticosteroids, the hydrocortisone, cortisone, Medrol dose pack, things of that nature that are very common in fighting inflammation. And also the use of supplements. Supplements can be herbal supplements, can be consumables, glucosamine, chondroitin, a biggie for years. Arthefect is a product that actually includes a lot of herbs and natural products, as well as the glucosamine and chondroitin. And that is manufactured by a company called Relive. Relive does development and research with regards to epigenetics primarily, which is turning bad genes off and good genes on. So there's a lot of great products from that particular company. Excessive weight or weight loss in this case is very beneficial for helping arthritic joints. Obviously, the heavier you are, the more compressive force on the joint, the more abnormal wear and tear that occurs at the joints themselves. Weight loss efforts include exercise as well as proper diet and nutrition. There are lots of things out there, and next few slides we can go over some of the anti-inflammatory foods out there, as well as the inflammatory foods out there. So foods to eat more of and foods to eat less of. And again, we don't have nutritionists on staff, but we have connections with licensed dietitians and nutritionists and certified nutrition coaches and so on and so forth if you're interested in learning more from the experts in this field. Orthotics or inner soles, very, very important for decreasing the excessive wear and tear or the abnormal wear and tear on joints. We carry a line here that we've had great benefit with. There's also a couple other lines out there that are very good as well. Bottom line is you should improve the alignment of your foot as it hits the ground, because everything else follows suit after that. And if you think about if you have abnormal position at the foot, that's going to create abnormal position at the knee, wear and tear on either the inside or outside of the joint, making the arthritic joint even worse. The use of heat or cold, very important. I tend to recommend cold. If you think about the word inflammation, what comes to my mind is a roaring fire. So why would we want to add more heat to that fire? We want to cool it down. We want to put it out. So that's why I recommend cold. Cold not only helps decrease the inflammation, but it also provides analgesia or numbing effect. So it helps relieve pain. Now, I said that we would talk about, or at least show you what some of the more common anti-inflammatory foods are, as well as the foods to avoid, which are inflammatory foods. First, this is a great pictorial of, and if you go online, you're going to find, the top 10, the top 15, the top 20, the top 8, the top 7. They all include a number of some of the more common ones. And this is just a great pictorial of what some of the best anti-inflammatory foods are. Your green leafy vegetables, which are high in vitamin K and vitamin A and vitamin C's. The kale, bok choy, celery. Beets is another good one, or broccoli, blueberries, antioxidants you hear a lot of. Pineapple, salmon is another big one that's anti-inflammatory in nature. Bone broth, simple. Soup. Different nuts. Walnuts are big. Using coconut oil as opposed to vegetable oils. Chia seeds, flax seeds, turmeric, we talked about in terms of supplements, ginger. Those are just some of the top anti-inflammatory foods to consume. Some of the foods that contribute to increased inflammation are grains. That's huge. Anything with gluten, casein, safflower, sunflower, soy oil, corn oil, the vegetable oils. Not good for you as compared to the olive oil and the coconut oil. And also with regards to the oil, be careful about utilizing olive oils in cooking, high heat. Make sure you have a high heat olive oil. Otherwise, it's going to break down into stuff that's not so good for you. So make sure you are aware of that. Read the labels. From my understanding, anything that is like extra virgin, first pressed, those are okay, but do read about that. Processed meats are also causes of increased inflammation, as are fried foods. Some meats and dairies are also contributors to inflammation. Syrup and soft drinks, because of the high sugar content. Sugar is a huge causer of inflammation within our system. And of course, fast foods, also not good because of the fried nature and the processed nature and so on and so forth. Telerehab or telemedicine is both for the patient as well as the caregiver. Basically, anybody who has difficulty getting to a brick and mortar facility, getting to a location. So if you're a patient, you may not have the ability to drive at the current time. You may be not have a license to drive because of age or other reasons. Whatever it is, if you don't have the transportation, you can't get to where you're supposed to be going. Other people have very busy schedules who don't have time during the day to get out to a facility. If you think about, a half an hour appointment, well, that half hour might turn into an hour or 2 hour ordeal because of the time it takes you to get to and from the facility. Weather conditions and travel conditions are also prohibitors or preventers of accessing care. For a caregiver, it might be just you don't have time to bring a loved one to an appointment. You have other commitments in life that you need to do, and it just may not be an easy thing for you to provide that transportation for access. And how good would it be if you were able to arrange an in-home treatment on a regular and consistent basis because of those facts. So telemedicine, what is it and how can it save you money? In a nutshell, the benefits are improved access, which affords you more timely treatments. The quicker you get started on recovery, the less secondary problems develop, and actually the more effective and efficient the recovery process is. You have cost savings, many of which are associated with just your time and travel of gas, tolls, parking, wear and tear on your vehicle, all those things that you really don't think about but can add up over time. And more importantly, time itself, the time away from the family, the time away from your friends, the time that you're not spending doing the things you love to do with the people you love to do them with. There's also the time away from work. If you have to take time off, you may have to take it unpaid, or you may have to take it using your vacation time. Either way, you're losing money, and again, you're losing the time that you want to spend with the loved ones around you. Benefits. In summary, there's no delays in treatment. It saves you time. It saves you travel expenses. And in many situations, rates can be lower than an average in-office visit because the overhead is decreased. You're not paying for additional resources. And the providers are able to pass that along to the consumers and in the manner of decreased rates. Some of the most frequently asked questions include the list here. So how do I know if I qualify to receive telemedicine or telerehab benefits? Well, in New Hampshire, we have both direct access as well as parity laws, which basically states that you don't require referral to receive physical therapy. And if you have health insurance, the health insurers have to pay in the same manner that they would pay for an in-office visit. Next question, what do I need to connect your telemedicine services? Essentially, internet connectivity. So if you have Wi-Fi or internet, you can access emails, you can access texting, you can access video conferencing. So essentially, anywhere you have connectivity, you can receive telemedicine visits. Another big concern is the security of the network. We contract with a provider that is HIPAA and high-tech compliant, so it maintains the safety of your personal health information as well as the security of the network itself. Will my private healthcare insurance plan cover telemedicine? Well, each plan is different, but if your plan covers physical therapy, then it must, because of the parity laws, cover telemedicine. It's that simple. Can I make an appointment for any time on any day? In theory, the answer to that is yes, because telemedicine is 24/7. However, the providers aren't necessarily open 24/7. Personally, our facility will be offering some before normal business hours and after normal business hours for scheduling, and even some weekends for scheduling as well. So it's all dependent upon the hours of operation. Another question is, can I make an appointment for any time of any day? Oh, I just answered that one. Sorry. What is an online physical therapy session like? In the absence of hands-on care, which is the ultimate form of treatment with regards to physical therapy, but not all people have access, so this is the next best thing. It is very similar to a normal physical therapy session. So questions are asked to provide answers with regards to the history of your illness, when it started, what makes it worse, what makes it better. There are questionnaires that we have people fill out so that we get better qualifying information with regards to what you're dealing with. And then we can ask you, if it's a televideo session, we can have you perform certain motions or maneuvers. We might ask you to bend over, squat down, stand on one leg, make a turn, walk across the room, get in and out of a chair, things of that nature. So we can actually see what's going on. Can I see a physical therapist online if I'm traveling or in another state? The answer to that is yes, as long as there's an internet connection. So say you're a loved one, or you are in the home of a loved one who's taking care of you. Well, telemedicine is there for you. So if I'm licensed in New Hampshire and Massachusetts, so a resident who lives in either Massachusetts and New Hampshire that might travel to a neighboring state, or across country for that matter, can have covered benefit as long as the therapist that's administering the treatment is licensed in the state in which you live. Can I see a physical therapist if I'm traveling outside of the United States? Yes, same thing holds true. As long as there's connectivity, you may. That does not mean that I can treat someone from another country or treat someone that lives outside of Massachusetts or New Hampshire, because those are the states in which I am licensed. How much does your service cost? Well, it varies according to what is being administered. So if it is going through health insurance, it is depending upon the rates that are billed according to our fee schedule, because we have to bill everybody the same. That is a law. On the other hand, we also have self-pay rates. If you're not going through insurance, we pass along savings. Those savings and the cost is dependent upon how quickly you want access to care and how long we are interacting with you. So if it's a 15-minute, 20, 40, 60-minute session, they all have different rates associated with them. What ages do you treat? Same ages that we would treat in our office are the same ages that we treat for telemedicine. If it's a minor, we demand that a parent or guardian, legal guardian, be in on the sessions and be present for those sessions. And do I need a referral, and will my primary care provider be notified about my online therapy visit? You only need a referral if your insurance requires a referral and if you're using your insurance as a form of payment because of the direct access laws. If you want your primary care provider to receive notes on the visits, then yes, they will receive correspondence and notes relative to your care. It's up to you. So those are some of the most frequently asked questions. At the end, if people have additional questions, I'd be happy to answer those. So that actually brings us to the end. So I want to thank you all for being in attendance. For those of you who were able to visit us live, I thank you. And those of you who have accessed this online or in YouTube, thank you for taking the time to do that. My contact information is here. Please reach out to me personally on my email, or you can reach me through calling the office. My extension is 104, or just ask for me. And I would be happy to return the call and answer anything that I can answer for you. Right now, I'm going to love you and leave you, and wish you all a great rest of the day. Thank you very much. This chart is actually a chart of our current rates, which you can see include level 1, 2, and 3. And the bronze, silver, gold, and platinum levels have to do with response time. Within 48 hours, 24 hours, 8 hours, and platinum being within 2 hours of being contacted. Anyway, it's for your information and perusal. Again, I want to thank you for joining me either in person or online for our presentation on telemedicine and how it has been proven to be an effective means of treatment for people with osteoarthritis of the knees. It certainly can be a game changer for people who can't get out, for caregivers of the elderly or infirm, and for people with very busy schedules. So if you're sick and tired of feeling isolated, afraid to pick up your grandchild, scared stiff at the thought of going out and having to walk long distances or climb stairs, or so busy that you don't have time to bring an elderly loved one for treatment, or you're just too afraid to even try. If you've answered yes to any of these questions, how much would it be worth to you if we could help you with the pain and debilitation of arthritic knees in the comfort of your own home? If you'd like to know more, either for yourself, for a friend, or for a loved one, please feel free to contact me directly. Below is my information. You can send a personal email to me or reach me on my extension 104 at our office phone number 603-644-8334. I'd be happy to talk to you. Thank you so much and have a great day.